All right, hello, my name is Cole Phelps. Doing my presentation here for OSU Research Week. Today's subject is inflammatory sources, exploring Google searches for gastritis. Background of our study: gastritis is a common form of inflammation of gastric mucosa with a prevalence of approximately 50% in developing countries due to Helicobacter pylori, and with an estimated 25% worldwide developing chronic atrophic gastritis. Research has proven patients are commonly turning to the internet in general prior to visiting their physician. Studies have also proven this trend in orthopedics and in gastroenterology. However, no such trend or link has been studied in gastritis. So in our study, we sought to classify questions on the internet about gastritis, as well as assess their levels of quality and transparency using Google's frequently asked questions. Our study is designed as a cross-sectional design search performed on January 27th, 2023. We used a clean and new browser, all data extracted in a masked and duplicate fashion. And you can see here what it looked like when we went and Googled our search terms. So it started off with these four search terms: gastritis treatment, gastritis surgery, gastrectomy, and stomach removal surgery. We then classified those frequently asked questions into fact, policy, or value type questions. Then we subclassified those into academic, commercial, government, medical practice, or media outlet by their source type. And then we scored by the JAMA benchmark or by the brief discern. JAMA benchmark measuring transparency, brief discern measuring quality. And here are our results. You can see here that most of the questions were fact-based and most of the sources were medical practice questions. Here's another breakdown of our results here, and again you can see in some of the most popular ones happen to be evaluation of treatment options, restrictions and timeline as well. Very popular, and this is kind of what people are searching here by source type. So our results, we concluded medical practices were unable to meet the JAMA benchmark. Academic sources were unable to meet the JAMA benchmark in majority, and government sources in majority were unable to meet the JAMA benchmark. Medical practices also had the lowest brief discern scores, whereas media outlets had the highest, but there really wasn't that many media outlets, but they still scored the highest here. In conclusion, the most common questions searched on Google pertaining to gastritis treatments are fact-based questions regarding restrictions and timeline till regaining normal activities. Medical practices were the most frequent source recommended by Google, but their online information was the worst for quality and transparency. So these medical practices are putting out studies answering these fact-based questions, but they have the lowest quality and transparency. And so, we as physicians need to educate our patients, one, what is proper online information that they need to go look, as well as, we should encourage, if we're going to write information online, we should encourage things that are going to improve the quality and transparency, things like date, author, and references, so that the information that we're giving people can be checked, can be sourced, and can be confirmed. With that, thank you. My colleague Jared will take any questions, and thank you so much. Here are our references.